Dr. Baliga here. The case scenario or multiple choice question discussed in this podcast is derived from an outstanding chapter on patient safety in Baliga's textbook of internal medicine, available at www.mastermedfacts.com. It's authored by Dr. Anjala V Tess MD, who is Associate Professor of Medicine at Harvard Medical School. She's a hospitalist in the Division of General Medicine and Primary Care, Department of Medicine at Beth Israel Deaconess Medical Center, Director of QI and Safety for GME at Beth Israel Deaconess Medical Center. During her second year as a hospitalist, she served as a Rapkin Fellow in Medical Education. She served as an Associate Program Director for the Internal Medicine Training Program, where she was in charge of quality and curriculum development. As a hospitalist, Dr. Tess currently teaches on medical wards and is Director of Education for the Hospitalist program. Dr. Eric J. Alper, MD, is Professor of Medicine at UMass Medical School. He completed his medical training and internal medicine at UMass Medical School. In 1996, he became the first hospitalist at UMass Medical Center and helped to create the Hospitalist program there. He was the Internal Medicine Clerkship Director from 1998 to 2007 and Patient Safety Officer for UMass Memorial Medical Center from 2003 to 2006. Key stakeholders in medication safety include all of the following except A. External regulators including the Department of Public Health, the Joint Commission, and the Centers for Medicare and Medicaid Services. B. Hospital personnel. C. Patients. D. Pharmaceutical supply companies. And E. The Board of Directors of the hospital. And the answer is D. Except pharmaceutical supply companies. Though the pharmaceutical supply companies are involved in the delivery of medications to facilities, they're not typically relying on the outcome of the process of care within the hospital. Patients care about the outcome of the drug delivery because they do not want to be harmed. Providers in the hospital and board of directors of a hospital are key stakeholders because they take pride in and are responsible for safety outcomes. External regulators are stakeholders because they've been asked by patients and society at large with overseeing care and ensuring safety in hospitals. Hospital systems that bill for Medicare and Medicaid must undergo periodic inspections by the Joint Commission. These unannounced visits to the hospital by a number of expert reviewers occur approximately every 3 years. The fact that these surveys are done without prior notice requires hospitals to be continuously ready to undergo review as opposed to studying for an exam. Joint Commission reviewers use tracer methodology in which the reviewers will examine the medical record of a patient and trace back through their hospital course, speaking with the various providers and visiting the various locations that the patient encountered. They speak with the frontline staff to ensure that they are aware of the appropriate standards and follow them in their practice. Deviations from standard practice may result in a requirement for improvement, RFI. Each RFI that a hospital receives must be met with an action plan and evidence of improvement within a designated time frame. The case discussed in this podcast is derived from Baliga's textbook of internal medicine from an outstanding chapter on patient safety authored by Dr. Anjala V Tess MD, Associate Professor of Medicine at Harvard Medical School, and she is a hospitalist in the Division of General Medicine and Primary Care, Department of Medicine at Beth Israel Deaconess Medical Center, BIDMC. She is also the Director of QI and Patient Safety for GME at Beth Israel Deaconess Medical Center in Boston. During her second year as a hospitalist, she served as a Rapkin Fellow in medical education. During this fellowship, Dr. Tess created a model to teach quality improvement to residents. She served as an associate program director for the internal medicine training program, where she was in charge of quality and curriculum development. Dr. Tess currently teaches on the medical wards and is the director of education for the Hospitalist program. She has led faculty workshops in both curriculum development and patient safety education. She is currently co-director of SHM and AAIM's Quality and Safety Educators Academy. Dr. Eric J. Alper is MD FACP, SFHM, is a professor of medicine at UMass Medical School, where he also did his medical training and his internal medicine residency. In 1996, he became the first hospitalist at UMass Medical Center and helped to create the Hospitalist program there. He was the internal medicine clerkship director from 1998 to 2007 and the patient safety officer for UMass Memorial Medical Center from 2003 to 2006. He is now the vice president and the chief clinical informatics officer at UMass Memorial Healthcare. He has received multiple teaching awards and has been recognized for numerous quality and patient safety improvements.